Okay, so if we look at the totality, which we haven't had a chance to address in all specific detail, but first and foremost, motivational interviewing is a communication style. It's collaborative. It respects the person's autonomy. It evokes the person's participation. All decisions are done in a partnership. The person's responsibility is given to them. They really have to be the ones to decide whether to go along with a regime or a health plan, etc. When it's done in the opposite way, which is an authoritarian telling style, whereby the person's side of the situation is really not listened to very much, it's not really taken into account as something that's very important to the process, there's no conveying of understanding, you're likely to get non-adherence because the client really hasn't had the opportunity, certainly not with you, to come up with their real reasons and motivators to actually do this. And a lot of what we're asking people to do are not easy things. Changing life habits. First of all, accepting that one has an illness in the first place. I've known many physicians, need to work on that first and foremost, that I actually have this, before I'm actually willing to do something about it. But if there is not the trusting, safe place for this dialogue, where the person feels that someone is really listening to them, trying to understand them, cares about what they think, feel, and say, you're likely to have a person who's shaped out, who's not participating, and that can really result in non-adherence because the person really has not come up with any of their own reasons to follow through on anything that you might think is in their best interest.